reported here in the United States. But as I explained on Monday, this new variant is cause for concern, but not panic. We knew there'd be cases of this of Omicron here in the United States, and it's here. But we have the best tools, the best vaccines in the world, and the best medicine, and the best scientists in the world. We're going to fight this variant with science and speed, not chaos and confusion.
That the first case of the Omicron variant in the U.S. had been detected here in San Francisco, and soon international travelers are going to have to be following new rules. Now take a look here. President Biden says early next week the U.S. will require all international travelers arriving to the U.S. to test within 1 day of departure. This is regardless of your nationality or vaccination status. So this is essentially requiring testing closer to your flight. This is part of a series of steps Biden announced today to try to slow the spread of COVID as we head into winter.
Jen, considering samples of Omicron were found in Belgium, Germany, and the Netherlands before South Africa identified and announced the first cases there, can you explain how the U.S. is continuing to justify a ban on travel from just South Africa? And is the administration considering bans on travel to any of those other countries? And how long will the travel ban remain in effect?
Well, we will continue to assess on a daily basis, and the president is meeting with his COVID team every single day, including this morning, to assess what additional steps should be taken to protect the American people. And he will always err on the side of protecting the American people. The decision to put in place specific travel restrictions from a set of countries was made based on the recommendation of our health and medical team, and based on the fact that there were hundreds, if not thousands, of cases that we were seeing in South Africa and concern about neighboring countries. So that was the decision that was made at that time. No one wants that to be permanent. As you know, we are assessing and reviewing, working 24/7. Our health and medical teams are to evaluate, learn more about this variant, and we will assess if additional restrictions need to be put in place.
And are you aware of any other cases of the Omicron variant in the United States at the moment, other than the Minnesota case and the California case?
We have been very transparent. I think, hopefully you would all agree, about providing that information as it becomes available. It typically comes through public health departments. They often provide it themselves first, but we are in close touch every single day with state and local public health authorities. So not that I'm aware of. Obviously, it, again, typically rises through public health officials. I would note, as this Dr. Fauci has said over the course of the last week, every single day, even the restrictions we put in place was not going to prevent this variant from coming here. It would just slow. That was the objective. So we do anticipate there will be more cases, and we know that will be the case, and that's why we're focused on doing everything we can to fight the virus and the variant.
Just big picture here. President Biden has repeatedly promised to shut down this virus. He has talked about wanting to end the pandemic. Is that still possible? Does he still believe that that is possible, or are we starting to shift now, especially with the rise of this variant, to perhaps accepting that we need to live with COVID for years to come?
Well, first I would say there's a lot we don't know about the variant yet, and that is challenging and frustrating. I understand for Americans, for all of you, and we want to give the space and time for the public health officials who are working 24/7 to assess and provide guidance on it. There are a range of options, as Dr. Fauci has spoken to and our medical experts have spoken to. It could be less deadly. It could be more. We don't know. So I just want to say that that is the next step in this process. The president, and you'll hear him speak to this today, continues to believe that if we build on the bold steps that we've taken to date, if we continue to make the vaccines more accessible, to increase testing, increase masking, we can return to a version of normal in this country. That's what everybody wants and everybody would like to see. Go ahead.
So you said you want to make testing as affordable and available as possible. So in addition to requiring insurers to cover at-home tests, is the administration doing anything to make in-person PCR tests more widely available, more affordable? Because as anyone who has had to get a PCR test, let alone a rapid PCR test, knows it can be hard to find one and expensive, and especially getting that quick test is very, very hard.
Sure. Part of the plan the president is announcing is free tests, about 50 million tests that we're going to make available at places like rural clinics, community health centers, to ensure they're broadly available in a range of places where people can go and access them. And again, this is part of our effort to build on what we've already done to date. We made $3 billion worth of investments to accelerate the production of rapid tests and expand capacity. When President took office, there were 0 at-home tests available. Now there are 8. This supply will quadruple this month from where we were at in the summer, and we're going to continue to build on this. So this is a step to make it more affordable for people at home, but to also make them more widely available at a range of locations, community health centers, rural health clinics, so that people can go and find them.
Thanks, Jen. I wanted to follow up on some of Alex's questions about some of the travel restrictions
Sure.
in Southern Africa. You say that the White House will continue to reassess those, but I wonder, we heard from the UN Secretary General who called these travel restrictions a form of travel apartheid. Is there any diplomatic effort underway on the part of the administration to address the concerns that have been raised about this decision?
Yeah, Mike, it's a great question. I mean, we, of course, are in close touch with, at a diplomatic level, with leaders in these countries about the steps we're taking and why we're taking them. And it's not meant to be a punishment. It is steps recommended by our public health officials and medical experts in order to delay the spread of a variant. Not prevent it again, but delay, in order to give us more time to assess and evaluate what this variant means. But of course, we are in touch through diplomatic.
On the new requirements for all travelers getting tested 24 hours before arrival in the U.S.,
Yeah.
who's going to be responsible for covering the costs for tests for Americans? Will that be individuals or insurance companies?
For Americans who are coming back into the United States?
Correct.
Let me check. It's a good question, and I just want to make sure I give you accurate information.
Another on the testing requirements. In many countries, it's still very difficult to get COVID tests, particularly ones with less than 24-hour turnaround in a timely manner. So what considerations are being made on this given the new requirements?
Well, as we're implementing any of these policies, we obviously take into consideration, as you know, in our prior announcement about requirement of vaccination, in countries where that wasn't available. I will check and see if there's any exemptions or anything that is going to be applicable in the same regard.
That you kind of get variations on this a lot, but
Yeah.
with the testing, public health people are saying, well, why not just ship these rapid tests to every American household? Or
Yeah.
why not require a vaccine or a test to fly domestically? Why not go further in the direction of public health and mandates, given the potential risk and the fact that we're headed into winter?
Sure. Well, one, I would say that nothing is off the table. Including domestic travel. But we do have some protections, some strong protections in place already, including requirement of mask wearing, which was extended, doubling of fines if people are not in compliance. How we look at this is, of course, we base our decisions on the advice of the health and medical experts, what's going to be most effective, and what is we can implement, what is most implementable. So we look at a range of factors as we make decisions about what steps we can put in place. So again, nothing's off the table, but the announcement we made today is building on steps we've taken to date, significant steps we've taken to date to continue to protect more people, put in place additional precautions that will save more lives.
Thank you. Just to follow up on international travel restrictions.
Sure.
Just to get an idea of what the general direction here is. You said the administration is going to assess day to day. And for example, today we learned that Norway is suspecting a large cluster of cases linked to the new variant. So what's the idea? Is it to multiply restrictions, or is it to lift those already in place because the variant has spread already and nothing can be done to delay the spread?
Well, we're going to assess both, and it will be assessed by the CDC, by our health and medical experts, and we'll rely on their guidance. So I wouldn't expect the lifting of restrictions before we know more about the variant. We will continue to evaluate if additional restrictions need to be put in place. None of these are meant to be permanent. None of them are meant to be a punishment. They're all put in place to protect the American people, to hopefully save more lives.
Two quick questions. The first is just because the Omicron variant is in several states, I'm just wondering if you could talk a little bit about why the travel ban still makes sense. And I know you talked about the timeline still being iffy, but could you just maybe explain a little bit more why those travel bans make sense right now?
Well, again, this is all based on, it's not a decision made out of the White House. Ultimately, it's based on the recommendation always of our public health and medical experts. They have advised several days ago the president to put in place restrictions on a set of countries where we are seeing the variant, specifically in South Africa, spread to hundreds, if not thousands of cases, and neighboring countries because of the concern about spread. We will evaluate every day if those restrictions, any of these restrictions should be expanded upon. But again, there's more at this point. We're still learning about the variant that our team is working 24/7 to assess. And I don't have any prediction of an end to any restrictions or additional ones at this point in time.